Yeah, for sure. Well, I think that, in terms of bioelectronic medicine, we're seeing technology change healthcare in the sense of really, eventually, and for me, and will happen for many others, replacing the use of drugs. So, no longer needing biologic infusions, injections, oral immunosuppressants, that kind of thing, and instead just modulating the immune system by stimulating the nervous system through the use of devices. So I think in the next 10 years, we're going to see more and more between implantable devices and transcutaneous devices, ultrasound, and all of those different, different new therapeutics that are going to make their way onto the scene in the next decade.
Yeah, I would agree with Kelly. I think bioelectronic medicine at Leaf, we're focused on biofeedback, which is another type of alternative, really treatment modality that teaches people to self-regulate their own body through feedback and technology. I think that that is increasingly going to be something that we're able to add to the arsenal of modern healthcare. And is there still a place for drugs broadly? I think the answer is yes. I think where technology can help us is that it can allow us to treat people better with fewer side effects in an iterative way going forward. And where technology sometimes isn't serving us in the best way is also worth, I think, thinking about. And that can be, sometimes there's a role for a tool, and then there's being able to interact with people and having a personal connection with, for example, your physician, and those things can be meaningful too. The connections, obviously, with your family and friends, also, of course, super meaningful and important for health outcomes. So, while technology is incredible, and we're going to continue, I think, advancing to things like bioelectronic medicine, biofeedback, and other modalities, I do think that it's important we don't forget about the human aspects of health and make sure that those come along with us.
The talks by Rohan and Kelly, if I can use your first names, uh, were extremely exciting to me, and of course, Rohan makes it sound like you know we can do so much that's relevant to consciousness in non-drug related ways. I think that's really thrilling. I mean, they both brought up lots of memories. I mean, I once thought I had Crohn's disease. It turns out I just had ulcerative colitis. So Kelly made me say, "Wow, I was lucky."
No, that's
and
a rough one too.
and I've been taking a drug for that for 40 years, and it seems to work. I'm also clinically depressed. I've been taking Effexor for that for 30 years. That seems to work. But I would just as soon meditate. I used to meditate when I was younger. I thought it wasn't for depression. I thought I was going to discover the meaning of life.